So, good afternoon, ladies and gentlemen, honored guests, salam alaikum. And I would like to welcome you to this session, which is entitled Building a Quality System for World-Class Healthcare in Abu Dhabi. We have today with us a very distinguished panel. We have Professor Barakat, Director General of the Health Authority Abu Dhabi. We have Suhail Al-Ansari, the Executive Director of Mubadala Healthcare, the UAE. We have Dr. Shetty, Founder and Chief Executive of NMC Healthcare, and Dr. Samir Elaham, although he's a consultant cardiologist and vascular specialist, he's here to represent the patient and quality interest today he's keen to inform me about. We have a very different session today, I think, compared to some of the other sessions, and possibly, I would actually say, for all of our personal interests, the most important session of this particular meeting, dare I say it. When I've been listening to the talks and other sessions earlier today, we've been talking about quite often products, manufacturing products, be they high-tech products, industrial products, and we've been talking about the quality of these products. But when we talk about healthcare, it's something very different. It is much more difficult to measure, or so I believe, and this is what I'd like to hope we can cover on this section. It's much more difficult to measure the quality of healthcare, what is happening on the patient pathway and what is happening on the outcomes for the patients. When we talk about traditional areas of manufactured products, it's a free market. If a product is not of good quality, people may not buy it again, and the company loses its market share. So there's a certain element of competition to encourage people to have high quality products. Very often in healthcare, when we're requiring healthcare as an emergency treatment, we don't have time to select the provider or read quality ranking tables. So we have to go to the nearest hospital, or we seek emergency medical treatment, and we take it on face value that we are going to have very high treatment to the highest standards of clinical excellence. But in fact, here is the first dilemma. How do we measure that? In earlier sessions, we've talked about the availability of various ISO standards, such as an ISO 9000 quality standard that people can conform to. But in healthcare, there are less obvious standards, perhaps less well known. There are no real global standards. So in today's session, this is what we will be looking at, is how can we look at quality standards? How will quality standards contribute to deliver innovative solutions to key priority issues, such as timely access to healthcare and customer-focused services? And certainly, this is the very interesting aspect, is people are expecting clinical excellence and good quality treatment, but also there is the patient care aspect coming into this. How do we define good quality patient care? So firstly, I would like to throw this question open to Professor Barakat, particularly in her role as a regulator, perhaps to define or state where you find the state of quality and how you view the situation in Abu Dhabi today in your healthcare systems.
Thank you. Thank you very much for the invite to be a part of this panel, and thank you for the important question. Quality means a lot of things. It's not just one parameter that one can check black and white and a hospital gets 10 out of 10. It's far more complex than that, and not all of it is objective. Some can be subjective, some requires information from patients, some requires data and numbers. And the spectrum is so large, it also includes things you don't normally think about. For instance, the doctors that are licensed to work in a facility. How was the licensing process? How rigid is the examination to allow the best of the healthcare professionals into the healthcare environment? So quality really is a huge subject. We are now in Abu Dhabi at a stage where the regulator, the Health Authority of Abu Dhabi, over the last 6 years now, so since the Health Authority was formed in 2007, previous to that it used to be called the General Authority for Health Services. It used to look after service provision as well, and the largest public provider. After 2007, the General Authority for Health Services split into two parts. One became the Health Authority that we are today, and I'm in that organization. And the other half is the service provider for the main public hospitals that we have today, Sheikh Khalifa Hospital and Tawam and Mafraq and Rahba and Al Ain Hospital, with the Gharbiya, with the ambulatory health, and the Corniche. So all of that is under Sharikat Siha. It now has no direct link to the Health Authority. It is a service provider. And the Health Authority is purely a regulatory body that tries to look at, monitor, analyze, assess, and comment on quality, both on Sharikat Siha, this part that used to be integrated into the Health Authority, as well as all the other healthcare providers. There are other public healthcare providers. Suhail Al-Ansari is the Executive Director of Mubadala Healthcare, so he represents a big chunk of non-Siha public sector healthcare. We have ADNOC, the oil company. They're a publicly owned entity with its own health clinics, and of course you have the police and the military with their own health services. So this is really the public sector, and then you've got the private sector. And Dr. Shetty is with us today, representing one of the private groups, the New Medical Center Group. The Health Authority is trying its hardest to monitor quality in all these entities in the Emirate of Abu Dhabi. At the minute, it relies on certain objective information that is collected routinely. So every time a patient goes to a clinic or a hospital or is admitted or takes a pharmacy prescription, there's a certain amount of information that's transferred automatically to the Health Authority of Abu Dhabi. That is collected, it's stored, we have it in a big database, and you can extract certain amounts of quality parameters from it. So all attempts up until now at doing a robust quality assessment of the healthcare sector has relied on this automatically collected set of parameters from the healthcare facilities. It is by no means complete, and it is by no means representative of what we need to do for much more comprehensive quality testing. And I think what you're going to see is over the next phase, in my own perspective, we've gone over phase one of transition of the healthcare sector in Abu Dhabi, where Abu Dhabi has gone from crawling to sprinting in about 5-6 years. So from 2007 till now, all sorts of things have been introduced that weren't even conceivable before. You know, we have electronic billing, we have data that is related to the Emirates ID card, we have prescriptions that are electronic, we have an insurance system. It used to be public versus private. Now we have a semi-privatized system with insurance. All activities are governed with an insurance card. And for Emiratis, as you would all know, the Emirati cover is fully subsidized by the Abu Dhabi government. So all of these changes happened in 5 years and 6 years. So now we're at a stage where we're looking back at the changes. As I say, you've gone from crawling to sprinting. We have to assess where we are now and make preparations for the future. And the future will rely heavily on quality. And we're talking about a lot more comprehensive parameters than the ones that are currently being collected. And they will be on par with international best standards. So at any one time, we could say, how does Abu Dhabi rank with the best in the world? And hopefully we can put Abu Dhabi on the same chart as the rest of the world, and hopefully we will be proud of what we see. And to do that, we require data that isn't automatically collected. It's going to be special data, or it's going to be data that may have to be done manually. It may have to rely on patient surveys. And it will require a hospital or healthcare inspection that is far more stringent than the current inspections. For instance, it could be a team of 30 people that spend a whole week in a hospital before they come out with their opinions of the quality of that healthcare provider. So, I think watch this space. Over the next few years, you're going to be seeing a dramatic concentration on specifically quality of care and how we do that. So that's not the whole, even if we solve that one, it's not the whole story, because what do you do with it? So you'll have good, robust quality assessments on all the healthcare providers. What are you going to do with it? What if it's bad quality? What if it's failing quality? What if it's excellent quality? You have to have a mechanism of rewarding the best quality and helping the ones that are not doing so well, even if it means more stringent measures against the ones that are not doing well. I mean, there's so much carrot that can be used, and occasionally there may need to be something more strict than a carrot for the failing entities. So more or less, I think this is a summary of my perspective for the time being, and I'm sure there'll be lots of interactions with my colleagues here. We have public sector and private sector, and before they start attacking me, maybe you can ask another question.
Okay, Professor Barakat, thank you very much for that. I thought that was a very good phrase used. Sort of healthcare in Abu Dhabi has come from a crawl up to a sprint, which says a large amount about the vast amount of change that has been going on in this sector. I'd like now to turn to Suhail and put that question further to him. So Suhail, in some respects, you are, as I believe, a colleague of Professor Barakat, in so much as that you are part of a government organization providing healthcare. We've seen, I've just heard a remark that Dr. Barakat made about needing measures to reward best quality. How would you have any thoughts about making best quality more transparent? So that, how could I understand that as a patient, potentially?
Well, it works. So good afternoon, and thank you for the invitation from the organizers, and of course Paul for your remarks. When looking at quality from the perspective of a provider, it's the way we look at it as a provider is how does that contextualize to the perspective of the patient? At the end of the day, we're here to serve patients. We are healthcare providers providing medical care to patients, and therefore, it's all about how does one empower patients with information that allows them to choose where they want to receive the best medical care that they want. However, there's a two-dimensional angle, I believe, to this, in that quality can range from A to Z. However, it's the definition to what that means to the patient. It's not just around clinical excellence and clinical outcomes. I believe that every patient has the right to believe, to expect the utmost best in clinical excellence delivered to them when going to a institution that is either well recognized or regulated by an objective body such as the Health Authority Abu Dhabi. However, it goes one step beyond in that in addition to that, there's a patient experience factor to it, which is to an extent a perceived element of quality. And therefore, as we have been over the past 10 years a part of Abu Dhabi's transformation in the healthcare landscape, we've seen tremendous amount of change, whether it be through an evolution of the health authorities means by imposing new regulations, some at international standards, some working towards that, while at the same time ensuring accountability is put onto the right organizations and individuals to do the right thing. And in terms of not only delivering what the population needs, but also what the population expects from that aspect. So by establishing institutions through international partnerships, which is what Mubadala Healthcare is all about, not only do we go ahead and invest and establish state-of-the-art facilities that are built inside out, however, we go even more importantly to the software, if you want to call it, within the institution, which is its people and the patient experience. So transparency plays a big role in terms of exposing and demonstrating the clinical outcomes then over a period of time that we manage to achieve through these partnerships. And we do that on an annual basis, whether it be through our operating facilities such as the Imperial College London Diabetes Center, through the Abu Dhabi Knee and Sports Medicine Center, which is our orthopedic institution, and so on and so forth. However, that's not the start or the end of it. Publishing outcomes based on international benchmarks and allowing the patients to have access to that information is absolutely important. And I believe that as the regulator, as Dr. Maha mentioned, Professor Maha mentioned, over the coming years, it's a space for us to watch out at, is that we're working towards hopefully having a standardized set of clinical outcomes, KPIs, indicators that will be set for all players in the market to adhere towards and publish against, so that there's a standardized means of measuring the performance of these organizations, ultimately for the patients to choose where they want to go and receive medical care and treatment from. However, going one step further is being very transparent about the software that I mentioned. Where are we bringing these individuals from? How are these individuals trained? Whether they be doctors, allied health professionals, nurses, technicians, etc., etc. Are they North American board certified? Are they European educated? Are they coming from reputable organizations in Asia, and so on and so forth, and having that information accessible to the public. Going one step beyond is ensuring that patient experiences are very well measured. There are systems in place for patients to be able to rate and rank the experience that they received. Yes, somewhat subjective, however, very important. Anecdotally, individuals, I'm sure many people around this room have experienced either themselves or through their families. One may go to a hospital and simply due to the fact that they may wait an excessive amount of time to be cared for reasons that they may know why, whether it be that there's a more intensive reason for another patient to be cared for as a priority is almost irrelevant. But that wait in turn translates to them that this institution doesn't deliver good medicine. It may not be very accurate, but in the absence of having standardized means to measure outcomes, processes, operational capabilities, it's very hard to measure. So having patient satisfaction surveys, ability to measure and be close to the patient's experience, and ensuring that the providers not only look into the patient's need, but also the extended family's needs is extremely important. We've learned that over the past, I would say, 7 years or so, providing care through our diabetes center to over 200,000 individuals, that it isn't just the clinical excellence of our individuals and facility, but at the same time, the experience that that patient has from the moment they pick up the phone to make a booking, all the way to when they receive their bag of medicine to go home after receiving care within one environment in the shortest amount of time possible, in an environment that is somewhat healing, really, really does work. And therefore, transparency plays a big role. It's not just about publications, but it's also about the ability to speak out and demonstrate that these individuals are being heard and action is taken towards the delivery of that expectation.
Suha, thank you very much for that. Again, some quite unique concepts there. And one thing you mentioned there about transparency of results, if I speak from personal experience in the UK, we are now accrediting medical laboratories, and this was actually something that came about as a misdiagnosis that happened in one particular hospital, with patients having to be recalled after a breast cancer screening incident. The rigor of the assessment is now being increased. We are just entering a new phase, and these are some of the things that you mentioned. So alongside the accreditation of the medical laboratory, we will be publishing key performance indicators that the professional body, the Royal College of Pathologists, has outlined as being essential key performance indicators can be lined up. And we will also be publishing how every laboratory stands up to what's called external quality assurance. So blank tests or samples are sent round to the laboratory. They have to analyze them, they have to say what they report, and we will be publishing where they stand. So you can see not only is it a laboratory with quick response times, but actually it's giving very accurate results as well as having good people. Now, moving on to Dr. Shetty, because I think Suhail, some of the things that you've said are sort of lead rather nicely into Dr. Shetty. Firstly, typically when we talk about healthcare, we tend not to think about the softer aspects. How do we measure the patient experience? And I guess this must be quite key for you, Dr. Shetty, running private clinics where the patient, it's outcomes and a good experience. But equally, there's another factor, if I can throw this in. It may be something that applies to your area as well. So Hal mentioned getting access to actually the clinicians, the medics and the clinical scientists. How do we know they're trained properly? So I put two questions to you: the soft aspects, quality of care, and where are these expert clinicians coming from? What do we know about them and their quality levels?
Thank you, distinguished panelists, my dear brothers and sisters. To be frank with you, it was His Highness, late the President of the country, Sheikh Zayed, peace be upon his soul. On his direction, everything was free by his benevolence, and with one slogan which struck me, that the quality healthcare for all at affordable cost. This is the thing which counted me to think about this. I was a jobless salesman in the country, running around everywhere for my livelihood. When I heard that, immediately I thought, let us add this. It was free at that time for everybody, locals, expatriate, everybody to take the treatment and to take the medicine for 1 year free. So that's the time I charged a little bit fee and gave a quality healthcare for the people. And the best laboratory, I did it. Most of the VIPs you went to Cleveland, Mayo Clinic, UK, wherever it is, came back and did all the tests, what they wanted to do. And one thing I did right from beginning is the quality of laboratory. Diagnostic is very important. If the diagnosis is made properly, treatment, they can go anywhere, they can afford to go. But now the things have changed. I'm really honored, distinguished forum, Abu Dhabi Quality Forum, that you put me in this distinguished panel, where I'm really honored, madam, to share the dais with you. And with this, His Highness Sheikh Mohammed initiative, that is the 9th pillar of this 2030 vision, the first thing what impressed me was empowering the private sector. Thanks to Mubadala, they are the first one to start this, and under the guidance, we also encourage to do more and more quality services. And as on today, with all your blessings, I'm sure every one of you, most of the people have used our services. At that time, very, very high quality we made, and now it's much more higher according to the regulation of the health authority. And also, we are now happy to add, because with your blessings, we have successfully succeeded in listing the company. The first ever GCC medical hospital listed in London, FTSE 250, it's your new medical center, NMC. And it's doing trading very well, and it's all appreciated by everybody. And I have not taken any money out of it. All the money I have invested in the healthcare facilities in Khalifa City and Burj, the Bright Point, that is the Jazeera Club. A first woman hospital I am making, it will be opening within 1 month's time. Women hospital, where we also have a delivery private, it's high class, top of the men. Only regulator should approve it. And after that, Sheikh Khalifa City, 55,000 square meter land in that 250 bed multi super specialty hospital. Why I did this? Also, I am now encouraged, because Mubadala has done a wonderful job. So any complication, any assistance we can have online. Within 10 minutes drive, we can go to that hospital. So my dear friends, I am here to contribute in the healthcare, whatever the initiative country has, health authority has got, Highness has, and we'll be more than happy. Thank you very much, sir. Thank you.
Okay. Thank you, Dr. Shetty. And certainly that is something I didn't realize. Clearly a very big achievement to have to be the first GCC company listed on the British London Stock Exchange and to be in the FTSE 250. So that's certainly a very good achievement, and an even better achievement to see the price of your shares rising, because that doesn't happen to many companies, or certainly not the ones I invest in. Now, moving on to Dr. Elaham, I think one of the things that I'd like to put to you is, we've talked about generally quality standards and quality of patient care and quality of outcomes, but actually, how do we define standards? What do we mean by a quality standard? And I hope with your experience in this area, you can enlighten us a bit with some of your thoughts on the many aspects of quality.
Thank you. Can you hear me? Yes? First, I want to thank each and everyone from the Abu Dhabi Quality and Conformity Council, including yourself and all your team, for organizing an amazing, amazing conference. The number and the quality are amazing. I want to thank my honorable colleagues who are on the panel, and I'm humbled to be part of this team. So let me tell you my perspective, because you know, when you have a hammer, everything looks like a nail, right? So I'll show you my perspective. So I'm a cardiologist. I was born in Damascus, moved to the States. I'm currently employed by Cleveland Clinic in Sheikh Khalifa Medical City, which is managed by Saha. I'm the Chief Quality Officer. I would like to give you, first, Mr. Chair, for 1 minute, the perspective of the patient, who I think all of us are totally aligned on what they think quality is all about. Then we'll talk about the standard. Would that be an acceptable plan? So if I was a patient, and we all are patients or will be patient, wherever you come from, whether you are here or in the States, we are all aligned. The patients want 3 things. These are really, I think, the pillars of quality, because the patients are the consumers and they make the decision. Number 1, they want to be kept safe. حافظ على سلامتي. And I'll tell you why this is important. Because we are sometimes having difficulty defining quality, and I think the easiest way to define it is the perspective of the patient. The next thing is heal me, عالجني. You know where the shifa comes from. But العلاج is our accountability totally in this blessed nation. And then number 3, be kind to me. Guess which one they know the most? Be kind to me. As my colleague from Mubadala, our colleague Dr. Barakat, and my colleague Dr. Shetty brought up indirectly or directly, the patient experience taints the compliance, taints the experience, and taints the perception of quality. So with that in mind, whatever I'm talking about as standards or even as a KPI, whatever I'm trying to standardize, it has to take care of that very important concept. Now, standards, as you know, is a huge topic, so I'll summarize it. I am on the panel for the JCI for standards, for example, for the 5th edition. It's a great process. We have, I think, a good publication, but that's really not what we're talking about. Anna, Mr. Chair, and colleagues, I think of standards as really standardizing care. That's what I think is more important. So I'd like to go a little bit out of this. And what I mean by this is the care is reliable. Patients expect reliable care. They can't come today at 8 a.m. and get good care, and then come in the midnight and have suboptimal care. The care has to be standardized, whether Samer from Timbuktu took care of the patient or Samer from wherever took care of the patient. So the way I see standards being applied is the standards that are from international benchmark are really taken and respectfully used in the United Arab Emirates, and I think we should be very, very proud that a country of the size of UAE is top when it comes to accreditation, certification, and the like. I think in that respect, Mr. Chair and colleagues, my personal opinion, as like you being an advocate to the patient and to the blessed nation of UAE, we're making amazing progress. The next step, I think, is we have to improve the way we improve. I repeat, we have to improve the way we improve. So when we talk about standardization, I think the way we need to do this is to go on measuring, which is what my colleague from Mubadala brought up, and Dr. Amaha brought it up several times in other meetings too and conferences. When we measure, we can definitely, from that measure, improve, and then we can build trust. Our goal we should never forget that our goal is to gain the trust, الثقة of the patient. Please remember our insurance card as Emirati, and I consider myself Emirati and very proud to say that, it's called ثقة. So the government was very, very wise from day one and even gave it the right name. But how do we establish this and how do we standardize care and go beyond standards in the narrow sense and go to the next step? I strongly believe that Emiratis and expats in UAE are expecting high reliability in healthcare, like anybody else in the world. I think the way I see it is, On one side, we're working on quality and safety culture. I'll tell my Emirati colleagues and non-Emirati, I came to this country in 2003, honest to God. We went to visit somebody, we went for dinner. At the dinner, I remember we ate Oriental food. They said, Dr. Elham, I want to tell you something. UAE expect top-notch quality, and those people were not even very well educated. Look at the reputation that this nation has, that quality is #1 in the DNA and the blood of everybody. Government, staff, people, humble, and dignitaries. So the next thing after that culture, which is obviously a journey, I think what people are talking about now are teams and tools, and I'll be very brief. Teams is what we heard about. Getting people who are first class, even ideally in the future having the best medical schools and nursing schools and administrator school, which I think is in the making, and we have good schools in UAE. But more importantly is having the tools. I personally look at Lean and Six Sigma and change management, things that have been amazing in the industry of my colleague, Mr. Hamadi. I don't know if he's here, in nuclear industry, as things that should be embedded and will be embedded and are being embedded in healthcare. In summary, I think the UAE is moving in the right direction. I think standardizing, if it comes to accreditation, I think we made great moves. I think standardizing processes is what I'm talking about. And I think improving the way we improve could be done by creating the right culture, which is being done as we speak, having the right teams which are being acquired, like what our colleagues brought up today, and some of our experiences, and finally acquiring, if not Six Sigma, then the tool of Lean and the tool of change management, which many of you know and even teach it, in a way to acquire, most importantly, the trust of the patient. Patient wants us to keep them safe, heal them, and be kind to them. That's my humble opinion.
Thank you, Dr. Elham. And I think that was a very good overview of a number of the tools that can be used to improve quality in healthcare, not just accreditation, but also some of the other tools that have been mentioned in industrial manufacturing areas such as Six Sigma, lean management, and so on. But moving on to our second part of the question, which is how do regulators and healthcare providers, it says in the question industry, but I think that was perhaps a mistake, it's how do regulators and healthcare providers align strategy and action plans to deliver results in quality? Dr. Barakat, earlier in the, I'll ask you this, to address this point first, especially in the context of a remark you made in the first session, which is, you said, we need to develop mechanisms for rewarding the best quality and perhaps punishing the poor quality in the context of how do regulators and industry align strategy. Do you have any thoughts on that, please?
I wouldn't quite use the word punish, but I think because at the end of the day, if it's the only service provider in a remote region, and we need to help them improve. So I think there are various stages of action that one can take, short of the onus is on improving, helping the healthcare entity improve, and giving them incentives to improve. So I think that has to be by far the focus, the strong focus of acting on quality measures and outcomes. How do we engage the various healthcare providers? Everything we do will take into consideration stakeholder opinions. So even for the health sector strategy, we've been working for months with all the stakeholders, all the entities represented on this panel, and we've worked together to come up with a set of priorities for which there is complete consensus. So I think it's a very unified team. We all understand the priorities. We're on the same wavelength. And at the end of the day, if we didn't have stakeholder engagement, then it would be much more difficult to drive through some of the changes that are being proposed. So genuinely, I've said it before, watch this space, and I think over the next few months, you're going to see some very important changes to the way we monitor and act on quality of care and patient safety in the Emirate of Abu Dhabi.
Great, thank you. And I think that actually, again, recapping certain remarks you made earlier, that you said the quality of healthcare in Abu Dhabi has gone from a crawl to a sprint. I think this is a very positive step that you've been able to take account of stakeholder opinions to get general buy-in to the direction that healthcare is going. Moving on to Suhail is, I guess you have quite a unique role in partnering or supporting the regulator. In that respect, how do you see your role in helping to drive up standards and quality in Abu Dhabi healthcare?
Okay, well, the role, the role and the partnership that any provider has to have with a regulator is absolute key to ensuring a successful delivery model systemically. We live no differently to that statement, in that it is absolutely important for a government-owned entity such as Mubadala to be very well aware and aligned with the understanding of what the regulator deems as priorities from a health system perspective for the Emirate, and therefore deliver towards that. What makes a strong regulator from my point of view in these few years having worked with the regulator is the empowerment to be able to use the regulator so-called stick when a job is well done, to ensure that incentives are there so that these organizations are rewarded. However, the converse is twice as important. If the job is not well done, what are the consequences and what are the remedial actions to ensure that the right incentives are in place, that is either remedied or not repeated, so that that benchmark continuously exceeds. If an organization like ours is aware, number one, what is the capacity gaps, and secondly, what are some of the qualitative indicators that need to be in place to be achieved through the establishment either of a service line and access for a specialized level of care, or urgent care, that is not only delivered on, but also exceeded. It creates a competitive landscape for other organizations to keep up, at the same time giving the ability to the regulator to point to a benchmark to say this is the level of which we as Abu Dhabi want to deliver towards. I think one angle that we haven't talked about here, and perhaps to put on the table, is that incentives are also very clearly driven through the payer. Sometimes that is through the government for the Emirati nationals, whether it be through the Department of Finance or through, in this case, the caveat of going through the health authority, but also at the same time insurance companies. In order for healthcare institutions to be able to sustain world-class care, they should be they also need to be reimbursed at world-class levels. Investment goes into human capital. Any specialized hospital on average would spend somewhere between 50 to 60%, if not more, on their operating expenses on human capital. That is a cost. In order to sustain that, not only attract, but also sustain, develop, and harness them over here, so that over the generations to come, that talent that today we're so dependent on bringing from outside, that talent can be transferred to a local population in the many decades to come, that investment return through the reimbursement can be sustained through the reinvestment into these people and its facilities. So the payer plays a big role in this. The alignment is key. Performers should be rewarded for their performance better than the non-performers. And non-performers should be, for lack of better words, disciplined in the right way, so that the so-called poor quality of care can over time diminish.
Discouraged, we'd use discouraged rather than.
Thank you.
Thank you very much. I think that's good to have a bit of inter-panel debate. Do feel free to contribute. Dr. Shetty, your views,
Thank you
please.
for giving me the chance. It's a very good excellency, Suhail Ansari. It's a very good suggestion. Incentivization is very important. I'm glad you said it here. Dr. Maha also here, Her Excellency. Doctor, you along with you, and you are also part of the Daman Insurance Board. So what's important is insurance should not only introduce DRG, according to the severity of the cases, patients should be allowed to, doctors should be allowed to treat. For this purpose, you can have a benchmark of JC accreditation, CAP, or ISO all these things, madam. With this, you can do a better healthcare delivery. Otherwise, what happens when the patient comes, oh, you are not allowed for this, you are not allowed for this. All these things, no patient want to hear that. They want the cure. We are insured. We are one of the best countries. Let us cope up with madam. This is my humble suggestion. Thank you.
Great, thank you, Dr. Shetty. One aspect I'll pick on. So we're looking at some of the views that have come out. We need to incentivize and reward the best performance. We've also heard the topic of cost. Healthcare costs are rising as well. Are there any quality tools that you believe can also help to deliver good quality performance, but also encourage, let's say, optimal cost, so that those rewards, such are given to healthcare providers, can be maximized for patient benefit?
So thank you for asking about what's very dear to the heart and the mind of our regulator, and also, most importantly, our patients. First, philosophically, the forest here is we are all caregivers, whether it's a regulator, whether it's a payer, whether it is a hospital or any caregiver. The issue of efficiencies is key in healthcare, as you know. So effectiveness is really meeting customer expectation. You are a customer and you expect to get something for the healthcare visit that you had or the encounter. The efficiency is obviously doing it with less resources or with less spending. And I think when we look at this, we don't need to reinvent the wheel. The literature now do support that there are models that will help us remarkably into decreasing that. I think the government of UAE has been fantastic, amazing, generous, visionary in supporting healthcare 24/7 by everything that I know of, and we're blessed to be here. For sustainability purposes and also for better results, I strongly feel, as an opinion that has been supported by many areas in the literature, both in the States, in the United Kingdom, and many other countries, that providing a leaner system and training key people and individuals in lean management is key. I'll take the example of supply chain, which is the easiest example, although please remember it can be done anywhere. In one hospital in the United States, in only one aspect of the supply chain, which by the way is around 2,200 aspect usually, they saved $350K in only one encounter. One hospital in Washington, Seattle, you remember our access, we want to improve access, has no waiting rooms anymore. They removed waiting rooms 2.5 years ago, which is obviously special, but still. So definitely a leaner hospital and a leaner healthcare system is where we're heading. In one of the pediatric hospitals in the United States, when you go and introduce yourself and say, I work on one of the floor, they say, can you show me your value stream map? That's how they talk even now. So I think lean is a simple concept. It talks about two things, and I'm not promoting anything here. I'm just talking about what I think is innovative, because I think the key thing here is innovation and sustainability. It's a reverse pyramid of servant leaders where the customer and the staff engagement is key. And the second one are tools to give our colleagues, Emiratis and expat, to really navigate into the amazing journey of quality in healthcare.
Okay, thank you. We are getting near the very end of our session, so I'll just make one quick summary. We probably have time to take perhaps one, possibly two questions, if there are any from the floor, before we wrap up. But really, what I've heard in this second part is perhaps bringing some thoughts together under the original remark made by one of the founders of Abu Dhabi and also repeated by Dr. Shetty, which is quality healthcare at affordable cost. And one of the ways of linking regulators and healthcare providers, I think some of the comments that have come out said we need to incentivize and reward those best providers. I will leave some of our panelists to debate later on whether we're talking about those who don't meet the best standards, whether they should be encouraged or whether there should be some slightly stronger measures taken against them. But certainly one of the other things that came over from remarks that Suhail made was we need to continuously exceed the benchmarks. And again, it's transparency of how all healthcare providers are performing against these benchmarks. And I think also then that's a key role for yourself, Professor Barakat, is in the role of the regulator, is highlighting what the key benchmarks performances are and holding all of the healthcare providers. And as we say, the payer, the state should incentivize the best performing organizations. Now, I believe we probably have, by my watch, just a couple of minutes. Are there any questions at all out there in the audience for any of the panelists here? We have one hand right at the back. I think a microphone's on the way. Perhaps you'd care to state your name and the organization you represent, then your question, please.
Yeah, my name is Ahmed Khawaja. I work for Dayton Consulting. My question is, when are we going to see the day that patients, whether Emiratis or expatriates, traveling abroad for treatment? With all the beautiful things we've heard, quality, but we still have a lot of patients traveling abroad for treatment. And the second question to Dr. Maha is, we probably understand there's some shortage of provision of medical services here. Now, how difficult for you as a regulator to impose regulations and improvements against the pressure from business? Thank you.
Okay, Dr. Maha, you take those.
So thank you. You've highlighted some very important aspects of issues we've been working with for months with the stakeholders and as part of the strategy. Clearly, it is not acceptable to continue sending so many patients for treatment abroad because we don't have a service available in the country. And that is one of our top priorities, to try and develop tertiary and quaternary level healthcare services in the Emirate of Abu Dhabi, mainly looking at trying to reduce the volumes of patients going abroad. Suhail Al-Ansari is heading the Cleveland Clinic Abu Dhabi project, and we're hoping when that opens in a year's time, many of the patients that are sent abroad for the subspecialties that will be offered there will no longer need to go abroad. So I think this is a very exciting prospect to look forward to in the next year. There are other specialties that we also will need to look at, and there'll be other measures to try and include the capacity in Abu Dhabi. It's really all about looking at issues and solving them with the stakeholders, with the government of Abu Dhabi, and the private sector. So we do, there's a very strong encouragement in the strategy of the private sector in the Emirate of Abu Dhabi. There are certain things that are easy for the private sector to do, and there are certain things that are far more difficult for the private sector. So you can't expect the private sector, for instance, to do a standalone, highly specialized service that requires an infrastructure of patients, volumes. Surgeons need to keep up their skills. So there are certain things that should currently be kept only in the public sector, because we can then control patient volumes and make sure that you have a center of excellence where all the patients go to, the doctors maintain their skill, and then there are other services that will be very appropriate for the private sector that aren't really influenced by patient volumes. The quality isn't linked to patient volumes. So, but in principle, yes, for your second question, we are strongly trying to encourage the private sector, and we see them as our partners in this. And of course, Dr. Shetty is on this panel, and he would be, he is already a key partner in the private sector provision of healthcare.
Okay, thank you very much. Well, looking at my watch, I think this session is due to end at 4:25. So at this point, this really brings today's session to a close. So firstly, I would like to thank my distinguished panelists here for their answers, their enthusiastic participation. I hope their responses have enlightened you and have been of interest to you. And finally, on a personal note, in closing this session, I would just like to thank my panelists. It's been a pleasure working with you, and also the Abu Dhabi Quality Conformity Council for the invitation to be here today and moderate on this session. So it's been an honor. So with that, I'd just like to say shukran and see you again, I hope. Thank you.